Today we'll be talking about the nursing process. As you've read in your text, the nursing process represents a universal intellectual standard by which problems are addressed and solved. The nursing process is our critical thinking tool. According to the American Nurses Association, the nursing process is a professional nurse's approach to identify, diagnose, and treat human responses to health and illness. The steps of the nursing process are assessment, diagnosis, outcomes, planning, intervention, and evaluation. We commonly refer to the nursing process by the acronym ADOPE. In this video, we'll be focusing on the steps of assessment, diagnosis, and planning. While we identify specific steps, it's really important to recognize that the nursing process is constantly ongoing and circular. We're always assessing and reassessing our clients. We evaluate our clients' progress, modify our plans, and intervene as appropriate. Remember that the process is fluid in nature. We will be learning the distinct steps at this time for clarity, but always remember that it is an ongoing assessment. So let's begin with step 1, assessment. During the assessment phase, we're gathering information in a systematic and deliberate manner. The purpose of our assessment is to establish a database regarding our clients' needs, health problems, and their responses to problems. We want to find out their health practices, goals, and values. We should also inquire as to the expectations our clients have for their visit or their encounter. We collect this data through primary and secondary sources. The primary source would always be the client and is typically the best source of information. Of course, there will be instances in which the client cannot provide the information you need. In those cases, secondary sources such as family members, the nurse's observations, the medical record, the healthcare team will all be utilized. The types of data that we collect include both subjective and objective data. Subjective data are obtained directly from our client, the things that they say and do. Objective data is data obtained through observation, examination, or discussion with other members of the healthcare team. We collect these types of data through client interview as well as the physical examination. Today we'll be focusing on the client interview. You will be entering a physical assessment course in your sophomore year, and that's where you'll really hone your assessment skills. During the client interview, we go through 3 phases: the orientation, the working, and the termination phase. In the orientation phase of the interview, you will begin with an introduction of yourself, identifying your position and explaining the purpose of the interview to the client. You must establish trust and confidence with your client. Some important behaviors to include are maintaining a client-directed eye gaze, affirmative head nodding, smiling, and forward leaning. You should begin the interview and orientation phase with some demographic data collection and ease into talking about more personal intrusive information. The working phase is the time to gather more in-depth information regarding the client's health status. Remain focused, orderly, and unhurried. You should utilize communication strategies such as active listening, paraphrasing, and summarizing to promote clear interaction with your client. You will be gathering data including the client's current level of wellness, a review of their body systems, their family and personal health history, and sociocultural history. You will also be asking questions about their spiritual health and their mental and emotional reactions to their current illness. This initial interview will be the most intense and thorough, with following interactions that will just be meant to supplement and update the database that you've started. The termination is the end of the interview and should include statements to the client that you are wrapping up the interview process. Be sure to summarize the important points that you've covered with your client and ask the client if that summary that you've given them is accurate. Following the interview would when we would be going to do the head-to-toe physical assessment. During this portion of the assessment phase, we would document our observations of the client behavior, our assessment findings, as well as collect diagnostic and lab data. We would be sure to document all of our findings in a timely and accurate manner. At this time, let's watch a video of the interview between a nurse and a client. Really critique this video. How did the nurse do? How might they improve on this interview? When we return, we will be discussing the diagnosis phase of the nursing process. Hello.
Hi.
My name is Jennifer. I'm going to be the nurse working with you today. What's your name?
Danny.
Okay, Danny. So you came up from the emergency department, right?
Mm-hmm.
And so you came into the emergency department today because you're having problems with what?
I have a cough and kind of flu-like symptoms.
Okay. How long has that been going on?
For about a week.
All right. Ever had a problem like that before?
No.
All right. Have you had a fever?
Yeah.
All right. Anything else going on?
Just cough and...
Oh, just wait. I got a page. Let me just check something. Oh, I'll be right back. All right, that was the wrong page. Don't worry about it. All right, so you just came in to be checked out because you have a fever, right?
Mm-hmm.
All right, any past medical problem?
Nope.
On any meds?
Nope.
All right, anything else I should know about?
Nope.
Are you allergic to anything?
No.
Okay. Stupid paperwork. All right, I just have to get this stuff filled in. It'll just be a few more minutes. Any family members?
2 daughters.
All right, are they going to be here?
Probably not.
All right. Who's your doctor?
Dr. Job.
Okay. Did they do anything down in the ER for you?
Nope.
They usually don't. All right. I think that's it. We'll go over the rest of the questions later.